Has the pandemic highlighted any areas of your field that you feel have been overlooked or neglected and deserve greater attention?
Absolutely. So early on in the pandemic, we started to see trends in the data of who was getting COVID and who disproportionately. If you can think back to the very beginning, where people who were positive with COVID in the US had only been travelers, primarily to China or I think Italy initially. At that point, we didn't know much about COVID and what was going to happen. But probably about a month in or so, we started to see data that suggested that Black and Latino and Indigenous communities were having higher rates of COVID. These disparities were not surprising, actually, because they follow with every other health disparity. Almost every health outcome, there is a racial disparity component to it. But what happened was, because there was nothing else going on in the country, all eyes were on COVID, we actually, I think more people were able to see and think about disparities for the first time, people who really hadn't focused so much on disparities. The other thing, of course, that happened is George Floyd was killed, and sparking, national movement against police brutality and really addressing racism. And I think the conditions of the pandemic, the fact that we were already talking about disparities, and then this national conversation about racism that I had not seen in my lifetime, really highlighted the fact that racism is not something we have actually talked about in medicine or in healthcare in a direct way. In medical training, we often learn about race as a risk factor, but I can't remember one time in my medical training where I was actually told that racism was actually the risk factor, not race. It was racism, not race. And so we are having conversations, needed conversations about racism for the first time. That is a direct result of the pandemic, the disparities in the pandemic, the fact that all eyes were on the pandemic, and so disparities were really highlighted across the country. And then on top of that, George Floyd being killed and the conversations that came out of that.